Good day, everyone, and welcome. My name is Genevieve Puthen, and I'm the Employee Wellness Specialist from Vaal Campus. With the rollout of the COVID-19 vaccine program by Department of Health, we have staff that often ask us questions about the vaccination itself. Today, I have the privilege of having Dr. nwu-pukke, who is Head of Campus Health Clinic from Potchefstroom Campus, who will be sharing his expertise and answering these questions for us. Dr. Emil, welcome.
Thank you very much for the opportunity.
Dr. Emil, one of the first questions we get is, what are the benefits of taking the COVID-19 vaccine? Why should I take it?
To take the vaccine is to your own benefit, because the disease will always be with us. And the sooner we get vaccinated, the sooner we will be, I don't want to say free of the vaccine, but we will reduce our chances of getting the virus and getting the virus to go to hospital. That is one of our main things about vaccination, is to reduce the hospitalizations.
Okay, so our signs or our symptoms will not be as severe.
You're right, yes.
Okay, so if I take the vaccine, would I get side effects, and how do I manage these side effects?
With some of the vaccines, the side effects are more than the others. I'm thinking about the immediate side effects like muscle pains, tiredness, headache. After the Johnson & Johnson, you will have that within a day, and it will last for about a day or two. And you can take Panado or Brufen or something like that. If it continues, you have to see your doctor, but that is not everybody gets that. It's a few people that will probably get that.
Okay, so the side effects are not as severe as if you had to have COVID. Okay. Another common question is about blood thinners. If a person is on blood thinning medication, can they take the vaccination?
It's not a contraindication, blood thinners, to take the vaccination. It means that they can take it. If they're unsure, they can ask the health professional that's doing the injection about their advice, or they can contact their private practitioner or doctor specialist to make sure. But it's not a contraindication to have to drink blood thinners and have the vaccination.
Okay. Another two categories where we get questions about are pregnancy and comorbidities. Is it safe for pregnant women to take the vaccination? And also, if a person has a comorbidity, would you recommend they take the vaccination?
Let's start with pregnancy. Pregnancy is not a contraindication to have the vaccine, so you can be vaccinated because it's not a live virus that you vaccinate. So people that are pregnant can take the vaccine. If they're unsure, they must please ask their gynecologist or their healthcare professional that's helping them. People with comorbidities must please take the vaccine because it will reduce their risk largely. So they are the target group. For starters, is the people with comorbidities, and that will reduce their risk of death dramatically or hospitalization dramatically.
Okay, so what people with comorbidities will decrease the intensity of the symptoms if they get
much. If you take a Pfizer vaccine, the Pfizer vaccine is 97% effective. It means that you have got a 3% chance to land up in hospital. If you're over 50, you've got a between 20 and 60%, and with comorbidities, you've got a between 20 and 60% chance of going to hospital or die. So it's much less if you have the vaccine than without the vaccine.
Okay, thank you for that, Dr. Emil. Another question that staff often ask: once I've had the vaccine, can I stop wearing a mask? Do I have to social distance?
If we can convince 40 million people to take the vaccines, we can go there, yes. The English are going there, I think, in 2 weeks' time, because more than 70% of the people has been vaccinated. So it means that the people that's vaccinated will have protection. So, yeah, we have to convince 40 million people to vaccinate themselves before we can do that.
Okay, otherwise we'd still be transmitting the virus, and we can still get COVID-19 anyway.
That's right, yes.
Okay, so another set of questions is around the flu vaccine, and it's if a person has the flu vaccine first, how long do they have to take the COVID? How long do they have to wait before they take the COVID-19 vaccine? Or if they've had the COVID-19 vaccine first, how long do they have to wait before they take the flu vaccine?
After you have received the COVID-19 vaccine, you have to wait 2 weeks to receive the flu vaccine. After you had the flu vaccine first, you have to wait 4 weeks to get the COVID-19 vaccine. If you have been tested positive for COVID-19, you have to wait 35 days after your positive test. Otherwise, you have to wait 30 days after the last symptoms have subsided to get the COVID-19 vaccine.
Okay, thank you for that, Dr. Emile. So access to the vaccine, I know with Department of Health, they've rolled it out for the over 60s and over 50s. I hear that people can walk into some centers to get the vaccine. They don't always have to register. Is this true?
It is true. The experience of people that gets vaccinated at the state facilities are really good. And people are really glad that they went there because they expected the experience of wait and unfriendliness, and it's not true. They are really helped there, and people want to help them there. So I want to congratulate the state on that. So at the state facilities on that, they can also get it at pharmacies, at some Dis-Chem pharmacies, some Clicks pharmacies. They must just go to the website of the National Health, and they will get the information there. But at the private pharmacies, they have to make an appointment. They don't have to make an appointment at the state facility.
Okay. Dr. Emile, I know you're very passionate about COVID-19 and about saving lives. So are there any plans about from the university side to roll out the vaccines?
I'm glad to say that after 6 months of struggling, I think we're gonna be accredited or accepted. I'm 99% sure, and I hope we can say that before the end of the month. So we'll start with a program, and we'll start to vaccinate as many people as we can, but we're allowed to vaccinate. So I'm excited for that, but we have to wait until we get there so that you can give them the good news on that.
Okay, that's wonderful, Dr. Emile. So we will send out a notice to staff as soon as the site has been approved and is ready to roll out the vaccination. But in the interim, people can go to the Department of Health identified sites, Dis-Chem and Clicks, to get vaccinated.
So, some of the clinics also do the vaccinations. I just want to say that please vaccinate yourself. It's going to save your life, and it's going to save a lot of people around you's lives. There's a big hype on social media of not being vaccinated. I think it's not informed people that does something like that. They don't want to save lives. I don't know what their reasons for that is, but please get vaccinated. It's going to save lives, and that's what we work towards, is saving lives.
Okay. That's very wise words, Dr. Emile, because sometimes even if our symptoms are minimal, it's the people around us that could have a severe reaction to the virus.
That's
so
right.
Thank you. Thank you for sharing that with us, Dr. Emile, and thank you for your time. I'm going to share a slide now with regards to where staff can get additional information with regards to the COVID-19 vaccination. And if you need psychosocial support, there are contact details as well where you can access these services. Dr. Emile, thank you very much for your information and your expertise. And I'm sure this has been very enlightening for staff.
Thank you very much.